My name is Lorna, and over the past year, from January 2012 to March 2013, I've been leading the Local Government Association's Health and Wellbeing Board Leadership Programme with funding from the Department of Health. Health and Wellbeing Boards were established by the 2012 Health and Social Care Act. They are intended to provide system leadership and to achieve improved health and wellbeing outcomes for local people. The programme has therefore been focusing on leadership development and aimed at supporting Health and Wellbeing Board members with the leadership behaviours, skills and knowledge to help them to operate effectively in a cross-organisational environment. The programme comprises a menu of activities that Health and Wellbeing Boards are able to access. These include a development tool which enables Health and Wellbeing Boards to self-assess their overall effectiveness. Regional chairs networks providing a safe forum for chairs and vice chairs of Health and Wellbeing Boards to work together on issues of common concern, exchange ideas and share learning. There's also bespoke support where we've pooled resources with the NHS Leadership Academy, enabling more than 60 Health and Wellbeing Boards to have benefited from individually tailored support to meet their specific needs. This video focuses on the regional simulation events which were organised between September and October 2012. These enabled Health and Wellbeing Board members to work together on tackling a range of challenging yet realistic scenarios. The events were commissioned and undertaken by the University of Birmingham. Over to Deborah Davidson to tell you more about the regional events.
Hello, my name is Deborah Davidson and I'm a Senior Fellow at the Health Services Management Centre at the University of Birmingham. Together with colleagues at the Institute of Local Government Studies here, we've been working closely with the Local Government Association to design and deliver a series of regional challenge events for health and wellbeing boards. The purpose of these events was to provide boards with a safe developmental space to consider how to respond to the real issues they will face, observe the way in which they work together on these challenges, and identify their needs for development. It also offered an opportunity to log where uncertainties and capacity issues existed. To support boards' ongoing development, we have put together a short video of participants' experiences of the events. Our first board member, Trevor, talks about the benefits of learning and what it helped the board to think about in terms of its role and what it's there to do.
It's been really good. We've been a shadow board for some time, and this gave us a real opportunity to look at how we work together. The scenarios were very realistic, and we've been looking at what the value added contribution we can make as a board, and what is it that the board is going to do that's additional to all of the other governance arrangements we've got in our respective organisations. And I think what we think is that we need to be quite strategic and to ask some of the kind of key questions rather than get into too much detail, so quite high level, because otherwise we're not going to add anything to the existing arrangements.
We can see from our next participant that even when boards have prepared well, the challenge events have helped members to get a better understanding of the work they have to do with partners and to build better working relationships across health and local government.
I think it's been a very successful morning. Actually, we had a Health and Wellbeing Board yesterday with a lot of discussion about the development of our joint strategic needs assessment and the health and wellbeing strategy, and today I've understood better how they would all fit together and how we'd work from those documents for a more holistic approach through integrated working with our CCG colleagues and the local authority.
I think there was some real learning for the boards today. I think, as I said, it's a fairly mature board, so they have been through some learning and processes together. They've also spent quite a lot of time together learning, which has been great and useful for them. But a lot of the things that came up today were around some big governance issues, particularly around how they relate to scrutiny committees, how they relate to cabinet decisions. This is also a district level board based on the CCG outline, so they also have the dynamics with the county level board.
And for me, I think it was a chance to reflect on the work that's already been done, an opportunity to meet with colleagues from all sectors, and to really start to work on the purpose of our role in the future and how we can really make the changes happen for our local populations.
Well, I think today has acted as a catalyst for relationships and understanding in the board, where we've been able to discuss some of the important issues for health and local government in terms of making health and wellbeing boards work. It will be the system leader in the future, and it's such an important relationship if we're able to transform services in a way that actually benefits citizens in our local communities. I suppose the importance of being able to sit down with colleagues who are drawn from different backgrounds, who've got different expertise, in order to clarify the priorities of the Health and Wellbeing Board, to make sure that it is delivering some short-term objectives and outcomes that benefit the population, as well as some of the longer-term strategies. So those really are quite important things, and about how to make sure that we really deliver for the future.
We know from partnership working in health and social care that different organisational cultures and local politics can create real tensions. The challenge events have enabled some boards to recognise that these tensions exist and need to be brought to the surface and worked with.
We're bringing together two different cultures, really. Actually, I think there's quite a lot of mutual understanding and respect anyway, but you know, there are issues about political drivers versus clinical safety drivers and things like that, which haven't come to a head yet, but potentially could in the future. So I think it's been useful to raise those, really.
I think some of the comments that stick in my mind and for going forward will be about elected members and GPs actually have a lot in common, in the sense they are there to care for the welfare of the people that they serve. And going forward, we really need to foster that, focus on what's really important, but also be able to challenge appropriately when it is in the interest of the people to do so.
Drawing on the expertise and leadership from all Health and Wellbeing Board members at particular points in time or for particular tasks is also an important capability that boards need to develop.
I think learning about who might be best placed to defend difficult decisions, really. You know, I think we had one issue where it was the possibility of closing a much loved small casualty and ineffective casualty unit, where you might want to put the GPs up to explain that it's much better to have a clinically safe A&E that's a bit further away than to have a clinically unsafe A&E unit that's very close, really. Whereas another issue was a kind of process issue that had gone wrong with Health Watch, and there you would be better to field the local councillors to talk about that, really. So, and kind of working out in advance who might be involved in media relations and so on, really.
I was working with quite a small board, and there was a real advantage in that because they were quite a small group of people, we could have a really in-depth discussion about some of the issues. The downside was that we also had to reflect on how a full board might work with some issues if the full range of folk were present. The group worked together really well. They were very inclusive, very respectful. They were very conscious of the progress that they'd made to date, but also of some of the big challenges that lay ahead. We also talked quite a lot about how they might handle issues of conflict in future. At the moment, they were very respectful, very polite, had a really nice atmosphere and ethos. But we did debate when we were reflecting what would happen if there was a really contentious issue that cropped up, if they had to discuss something really difficult and if they had to really fundamentally disagree with each other, and then come back the next day and know each other well enough for things still to be okay. I think the most interesting thing for me was when the board started to discuss what kind of paper it wanted to receive at what kind of stage. Some of the issues they wanted to receive quite a detailed analytical paper at a fairly late stage in the process when it was all worked up. For other kinds of issue, the board wanted to receive something very early on when it was still very exploratory and they could help to problem solve and to try and genuinely understand the nature of the problem together. And I guess the difficulty for the board, for its chair and for staff in participating organisations is knowing which kind of issue is which kind of issue, what kind of papers the board wants to receive, when and how. And that felt like quite a communication and quite a cultural challenge for boards going forwards. One of the things that struck me most is the importance of time and space away from a very busy day job. The very real life scenarios, I think, help to anchor the discussions in reality and in frontline practice. But actually this was probably the most time that some of the board members have ever spent together in one go, and actually gave them real scope to explore some of the issues that crop up in meetings in much greater depth than would be possible in the workplace.
I played back to the board some of the language they were using, which was quite belligerent. I think somebody talked about being love bombing an area, and somebody talked about kneecapping the chair of scrutiny. And we had a discussion about that kind of language in a public arena and how that might come across, even though, because they're quite informal with each other, they understand and they don't take offence at that at all. If you've got new members of the board joining, for example Health Watch, how they're going to sort of feel if there's that kind of language going on, and if you're acting out in a public arena, how some of that language might play. So I think just reflecting that back to them made them slightly think perhaps because there's such a strong nucleus working together, perhaps they just need to be a bit more aware of how they might be being viewed by other people. I think they really benefited from the exercise going around and talking to other areas about how they're going to co-produce their health and wellbeing strategy. I think it was quite clear that most boards for this time had done a very traditional kind of engagement, with consultation on issues that had already been agreed, and they're all very clear that they want to do something different next time. So I think they're really going to go away and try and do that. And I think it reassured them as well that they are doing pretty well actually in terms of their board. What they do want to go away and do is to really iron out some of the governance issues and some of the issues around, perhaps the communication protocol, who does what, who speaks on behalf of the board, and some of the issues around perhaps the Health Watch role and how much they sort of support that. So I think some definite learning points and some definite things that they're going to take away and develop over the next few months.
We've drawn on the learning and outcomes from all of the programme activities over the last year to produce some legacy products, including case studies and a simulation resources tool. These can be found at the LGA website coming up at the end of this video. Inevitably, as health and wellbeing boards take on their statutory role from the 1st of April, new challenges are likely to be thrown up, and the LGA is currently finalising the scope and nature of support to be provided from April onwards.